My name is Jess Fenchel, and I'm the Vice President for Adult Behavioral Health and Crisis Services. Suicide prevention is all the things that we do to prevent suicide, which really means all the things that we do to encourage healthy communities and healthy people and wellness. There's a lot of pieces to that. Some of it is education, some of it is knowledge of resource, but really, for me, I think it's about connection, creating connection and opportunities for people to get what they need as individuals so that they can be really well.
Suicide prevention is important because people need other people who can ask them about whether they're thinking about suicide. And a lot of people are wondering, does anyone care? Is anyone really willing to talk with me and go here? Does anyone care enough? And we need to have people who are able to have that conversation, who are willing, ready, and able to go there with people. Because if we don't have people able to do that, then people are going to feel alone and have no one to talk to.
How can communities practice suicide prevention activities is a great question. There's a lot of layers in communities, so there are a lot of ways that you can come at the issue of suicide prevention. I'm thinking about schools and churches and civic groups, and then obviously you look at your provider community. What are the things that the provider communities can do? Certainly parts of that is your emergency responder communities like emergency departments, law enforcement, obviously your crisis program. So all of those things really working together. Schools, we want to do a lot of education in schools from really young ages. So bullying is a topic that's come up often in schools as one trigger that students are dealing with. When we look at students who die by suicide, what were some of the triggers? That comes up a lot. Are we teaching kids at really young ages how to communicate well their frustration, how to share with one another things that they wish they were getting in their relationships with their peers? In churches, do we have connection to resource for congregants? Do churches recognize their role in supporting the community and in supporting wellness in their communities? Do civic groups know the resources? Do they know how to help people be connected? The same can be said with law enforcement. If you can't arrest a person or take a person to a hospital, there's not a whole lot that officers have to do at their disposal unless they have really robust connections with the provider community that can help link people to the social services that they so badly need. So what we've been able to do is recognize how do we help create those layers of connection so that they have resource. Look for ways to be connected. More and more in our society, we recognize that there's a lot of disconnection. It happens because of technology and because of busyness and whatever you want to call it, the whirlwind. It's harder and harder to stay connected in meaningful ways with one another. So really challenging ourselves and our communities to look for ways to build that connection.